Hello everyone, this is your Dr. K. Samyukta, consultant urologist and urogynecologist. Today we will talk about a topic called as vesicoureteric reflux. So what is this vesicoureteric reflux? Normally the urine flows in a single valve or a single way direction from the kidney through the ureters, through the bladder and outside the body. Because of multiple reasons, if this urine starts going in a reverse direction, that is from the urinary bladder into the ureter and kidney, this is called as vesicoureteric reflux. This is a reflux. So this reflux can be of two types, or it can be a primary reflux or a secondary reflux. Primary reflux means there is basically a defect in the valve or the opening of the ureter into the bladder. This defect can result in urine flowing backwards, resulting in a reflux. The secondary causes can be obstruction. If there is a long-standing obstruction at the level of the bladder outlet or the bladder, this causes significant pressure in the bladder, causing reflux or reversal of the urine back from the bladder into the ureter. There can be multiple secondary causes of this bladder outlet obstruction. This vesicoureteric reflux is also graded into different types. There is a grade 1, there is a grade 2, grade 3, grade 4 and grade 5. This grading is based on how the reflux is happening into the ureter, and also at the same time what this reflux is doing to the ureter as well as the kidney. How much of dilatation is there, how much of tortuosity is there. Based on that, this vesicoureteric reflux grading is generally done. So how do these patients with vesicoureteric reflux generally present? They generally present with repeated attacks of urinary tract infection, or they are present on UTI antibiotic prophylaxis for a very long time. They can present with severe pain in the abdomen. Sometimes what happens is this vesicoureteric reflux in higher grades present for longer time can cause damage in the kidneys. If vesicoureteric reflux is left untreated without detecting it, this can result in repeated attacks of urinary tract infection, reversal of the urine back into the kidneys, which can cause decrease in the function of the kidneys. It can cause scarring in the kidneys. It can result in chronic kidney diseases and hypertension. Hence, it is very important to treat this vesicoureteric reflux. Generally, how is this vesicoureteric reflux detected? Generally, it is detected using a test called as micturating cystourethrogram or a voiding cystourethrogram. Using a voiding cystourethrogram or a micturating cystourethrogram, we can detect if the patient has presence of vesicoureteric reflux and also can grade the reflux. Apart from that, we also do other tests called as DMSA scan to see the effect of this reflux on the kidney. Next, lot of people ask us what are the treatment options for this vesicoureteric reflux. Generally, if this vesicoureteric reflux is detected very early, that is and before the age of 5 years, generally we wait up to the age of 5 years. Generally, especially grade 1 to grade 3 reflexes tend to disappear by themselves. If after 5 years also, if this reflux is not resolving or it is persistently present, then we give them different options like ureteric reimplantation or a detrosophy. Apart from these, we also have the submucosal ureteral bulking agents, where we introduce a special chemical which prevents this reflux from happening. So vesicoureteric reflux, when detected, not every time does it require surgery. First we need to grade the level of reflux, and then only generally grade 1 to grade 3 reflexes we try to manage them conservatively. Grade 3 present bilaterally or grade 4 or grade 5 reflexes, if it is not resolving and if it is causing significant decrease in the kidney functions, we opt for surgical options. Thank you.